This morning in Family Time, we're hearing a lot about the ongoing mental health care crisis, especially in teens. So what does that mean exactly? Local psychiatrist Dr. Tanuja Gandhi from Bradley Hospital is here to explain. Thank you so much for joining us this morning.
Thank you for having me.
All right, so let's get right into it. If you have a teen, what should we be worried about? And what exactly is this teen mental health care crisis?
So if you have a teen in the home, I think it's really important to know that increasingly since the pandemic, we've seen higher rates of depression, anxiety, teenagers presenting with suicidal thoughts and even suicide attempts. So this is something that all families need to know is happening in the world around us.
Yep.
Because teenagers are going to school in other places where all the other teens might be struggling with similar issues.
Yeah, so are we still seeing an increase in this from the pandemic?
So in the clinical world, if you ask any mental health professional, they'll tell you we were in a situation that was similar to a crisis even before the pandemic, with increasing rates of depression, anxiety, and children presenting with suicidal ideation even before the pandemic.
Okay.
What the pandemic did is highlighted that there's a problem and made it so much more worse.
Yeah.
And what we are seeing now is we don't have the same increases during the pandemic, but we're still seeing a steady increase in children presenting or teenagers presenting with mental health problems.
Who have lived through the pandemic.
Yeah.
And now they're dealing with the after effects, I guess. What's being done to address this problem?
So historically, there's never been enough psychiatrists or mental health clinicians to take care of the population in general, especially children and teenagers.
Yep.
What's being done at this point in time is we're doing a lot more virtual programming. There's a lot more thought around innovative programs to provide access, be it support to pediatricians, who children see as a first point of contact, or providing access through programs that are now getting more creative in providing telehealth as a service.
Which I think is something good that came out of the pandemic, right? That we're learning, or that we have learned. What are some of the signs? If I have a teen at home, what are some of the signs that parents should be looking for?
So if you have a teen at home and you're questioning, are they struggling with an emotional or a mental health crisis? Things to think about would be, is there a change in their daily functioning? Are they sleeping less or more? Do they look depressed? Are they talking about, what's the point in living? Or actually clearly making statements about wanting to die? So any change in baseline functioning should at least raise the question, is there something going on? And help parents think about having a conversation about it.
All right, and what's one of the first steps they should take if they are in that position? Give you guys a call?
Yes, I think the first step that parents should take would be to get an assessment of the situation, talk to the child, and if there's a need for immediate attention, definitely give KidsLink a call or take them to the emergency room.
All right. Thank you, Dr. Gandhi, so much for being here today. Such an important topic. And for more information on recognizing signs and finding help, you can always call the free and confidential KidsLink line. We've put that at the bottom of our screen, or you can head to roadshow.com and we'll post all the information there as well.
Lots of